you guys doing? Sorry for the late delay of the videos. I had my exam, so I couldn't make the videos. But now I'm finished with the exams, so I'm gonna make the videos. Right now I'm gonna make the anatomy video of head and neck. So hope that you guys help, and thank you all for so much subscribes and so much love and from the followers. So thank you very much for that. And keep subscribing, and I'll keep making videos, and hope that my videos will help you guys in your future and you guys become great people and great doctors. So thank you everyone, and hope you enjoy this video as well. Thanks. Hi guys, today we're gonna study about the region of the neck. First of all, before going into the triangles of the neck, let's have a brief introduction to the neck. Now you can see here, this region, this is the neck. This is present between this part that is called the face and the next part which is downward, that is called the thorax region. So between the face region and the thorax region, the space or the area that is present, that is called as the neck region. Now, what is its shape? It is basically quadrilateral. Now, what does quadrilateral mean? That it consists of four surfaces. This is the superior surface, then you have an inferior surface below. There is a front surface, that is the anterior one, and below or behind you have this posterior surface. So all together these four surfaces are forming a shape that is called the quadrilateral space. Now, superiorly, what is present? The structure that is present above the neck. Above the neck, the structure that is present, that is called as this, which is the mandible, the base of the mandible. So above the neck, you have this structure called the base of the mandible. Now inferior, below your this neck region, you have a bone that is called as this one, called the clavicle bone. So below it, you have the clavicle. Above it, you have the base or body of the mandible. Now, what are the structure that is present in front of the neck? In front of the neck, you can see this curved line. This is called as the midline. So this is present in front of it. And behind it, you can see this large muscle. That is called, you have this one. This is called as the trapezius muscle. So these were the relations of the four surfaces. Above, you have the you have this base of the mandible. Inferiorly, you have the clavicle bone. In front, you have this line that is called the midline. And behind, you have this large muscle called the trapezius muscle. Then you have that you can see that this muscle, there is a muscle that is called the Sternocleidomastoid muscle. This muscle is going to divide the region of the neck into two triangles. The triangle that is formed in front of the sternocleidomastoid muscle, here you can see, that is called the anterior triangle. And the triangle that is formed behind the dissection of the sternocleidomastoid muscle, that is called the posterior triangle. So there are two triangles in the neck. In front of it, the anterior triangle. Behind it, you have the posterior triangle of the neck. Then what is its nerve supply? It is supplied by the cranial nerve number 2, 3, and 4. And it consists of two fascia. The one that is present in front, that is called as the superficial fascia, and the one that is a little deep to it, that is called as the deep fascia. That was all about your introduction to the neck. Now what we're going to study about is that we're going to study first of all the triangle of the neck. First of all, we're going to study the anterior triangle of the neck, which is going to be clearly, I will help you understand it with the help of this diagram. Now, first of all, let's start with this diagram. This is basically the front view of the neck. Here you can see that this is a neck, and these are some structures which you have no idea what is going on here, and you're just going to rub your hair in it. So let's make friends with these triangles of the neck. First of all, you should know, so now let's make friends with this triangle of the neck. First of all, you should know the relation of the anterior triangle of the neck. We're going to now see the triangle that has been formed by the dissection of the sternocleidomastoid muscle in front of it. That triangle is called the anterior triangle of the neck. Its relation is that in front or superior, above it, you have this body of the mandible. Posteriorly, you have this sternocleidomastoid muscle, and in front of this, you have this midline. So relations are superiorly, you have the base of the mandible or body of the mandible. Posteriorly, you have this muscle, the sternocleidomastoid muscle, and in front of it, you have the midline. That was the relation of your anterior triangle of the neck. Now, this anterior triangle of the neck is further divided into 4 triangles, which have been shown to you in this figure. The first triangle that is formed here, that is called as your submandibular triangle, also called as your digastric triangle. The second triangle, which is formed here, that is called as the submental triangle. And the third triangle that is formed here, that is called as your muscular triangle. And a triangle here, that is called as your carotid triangle. So these were the 4 triangles which are further subclassification of the anterior triangle of the neck. Now we're going to study one by one each of these triangles and the relations of them and the structures or the contents that pass through each of them. Let's start with the first one, which is this triangle. So this triangle you can see is formed. This triangle that is formed, that is called as your submandibular triangle or digastric triangle. Now what are its relations? You can see that above this triangle, which is drawn here with your blue mark, above you can see this line of red color marker. That line which is present above it, that is called as your body of the mandible. So you can say that superiorly, or the superior relation of this submandibular triangle is basically the body of the. So we can say that the superior relation of the submandibular triangle or the digastric triangle is this body of the mandible. Now you can see that in front of this curve, not this one, this curve, this one, this is present. So we can say that the anterior relation of the submandibular triangle is this anterior belly of digastric muscle. Now we can see that behind this submandibular triangle, you can see another curve, this one. This is called the posterior belly of the digastric muscle. So we can say that the relation of the submandibular triangle is superiorly body of the mandible, which is this horizontal line. Anteriorly, you have this curve of the muscle that is called the. So anteriorly, we can say that anterior relation of the submandibular triangle is the anterior belly of the digastric muscle, and posteriorly, you have the posterior belly of the digastric muscle. Those were the relation of the submandibular triangle. Now, what are the contents or the structures present in this triangular, which is the submandibular? They are basically your facial artery and vein. You have a nerve, you have a gland that is the submandibular gland, and you have the lymph node. That was part of the triangle of the neck, which was the submandibular triangle. Now coming to this triangle, which is triangle number 2, called the submental triangle. Let's study about its relation and the structures passing through it. First, let's see about its relation. Now you can see that present not above it but lateral to it, you have the muscle, this one, that is the anterior belly of the digastric muscle. So we can say that is the anterior belly of the digastric muscle. Now present medially to it, you have this line, which is the midline. And present below it, you have this bone, this one, called the hyoid bone. So the relation of the second triangle is the lateral. You have anterior belly of the digastric muscle, medial, the midline, and inferiorly below, you have. Now, when we have studied about the relations, let's study about the content or the structure. The structure only present in the submental triangle are your submental lymph nodes. Now coming to the third triangle, which is this one. This triangle is called as your muscular triangle. Now what is its relation? Now you can see that present above it, superiorly, you have this hyoid bone. So you can say that the superior relation of the muscular triangle is the hyoid bone. Then present medially to it, you have the midline. So medial relation is this midline. And present laterally, you have two muscles. Superior laterally, that above, and laterally you have this muscle called the omohyoid muscle. And present below and laterally you have the sternocleidomastoid muscle. So let's review the relation of this. Superiorly you have the hyoid. Review the relation of the third muscular triangle. Superiorly hyoid bone, you have medially the midline. Superior laterally you have this muscle called the omohyoid muscle, and inferior laterally you have the sternocleidomastoid muscle. Now we will study about the contents, the structures passing through. Here you have a muscle called the sternohyoid muscle. You have your thyroid gland, you have the parathyroid gland, and you have your pharynx. Now coming to the last triangle, which is this one called the carotid triangle. Now you can see that above this carotid triangle is this, which was called as the posterior belly of the digastric muscle. So we can say in superior relation of this is the posterior belly of the digastric muscle. Now you can see that, what is this? This one. Relations, you have superiorly, you have the posterior belly of the digastric muscle, laterally the sternocleidomastoid muscle, and medially the omohyoid muscle. Now, what are its contents? You have the internal carotid artery, external carotid artery, together called the common carotid artery, passing through it. You have your vagus nerve and you have your hypoglossal nerve passing through it. So that was all for the anterior triangle of the neck. Hope they will help you understand it and make it easy for you all guys. For more videos, like and subscribe the channel. Thank you.